Alzheimer's.
Okay, but we are here to talk to you a little bit about what Alzheimer's is and the areas of the brain that it could affect. Okay, so I'm going to start off by explaining to you our 3D model that we've created, which is the brain. I'm explaining to you first how Alzheimer's affects the frontal lobe, which is the frontal part of the brain. So the frontal lobe plays an important role in behavior and helping prevent us from doing things that may be threatening to others. So damage in the frontal lobe may result in things like loss of motivation or loss of intelligence, judgment, behavior. For example, like urinating in public. Old people have done that. Or also like struggling to get out of bed, or getting agitated, like having a hard time to breathe. That's usually in like the last stages of Alzheimer's that happens.
Next, we will start with the temporal lobe, which in Alzheimer's means loss of memory. The temporal lobe in the brain is used for memory. Damage to the temporal lobe means that while certain objects might be recognized, there's little or no ability to capture new information and remember it later. In such circumstances, a person with early memory problems can be helped to recall information with cues such as photographs, or reminding the person or other people who were at a particular event, and so on. It is episodic memory that is most affected in Alzheimer's disease.
Hello. Okay, so now I'm introduced to you the occipital lobe, which is the purple region here in our brain. Okay, so as you know, Alzheimer's causes damage to all the lobes of the brain. And to the occipital lobe, it causes inabilities to recognize, and also it can result in visual hallucinations. Some examples could be like the patient having trouble remembering someone's name, or like their loved ones' names and stuff.
Next, we will discuss the parietal lobe, which is loss of language in Alzheimer's. The parietal lobe has an important role in integrating our senses. In most people, the left side parietal lobe is dominant because of the way it structures information to allow us to read, write, make calculations, perceive objects' normality, and produce language. Damage to the dominant parietal lobe can lead to German syndrome, which is when you can't tell from left or right, you can't point to names, fingers, and etc. Damage to the non-dominant lobe may result in inability to recognize faces.
Okay, so this is our project board that we did, and right now we're going to talk about the 7 stages of Alzheimer's, which is listed right here. So first, let me start with stage 1, which is right here, which is called the no impairment stage. In this stage of Alzheimer's, you really can't notice anything, like family members can't notice if you're forgetting things yet because your brain is still functioning normal. You won't notice the memory loss. In stage 2, which is right here, is called the minimal impairment, also known as the forgetfulness stage. In that stage, you already start forgetting things like names of people that you know, but it's still not that noticeable yet. Only close people, people that you're close to, they will start to notice, but like if you go to a medical examination, they really won't know that you have Alzheimer's yet. Okay, so right here in stage 3, which is called mild cognitive impairment, and during this stage, you can already notice that you're forgetting things. It's like your memory loss, it's advanced more. And things that you might forget will be like the names of new people that you have met just yesterday. And also, if you go to a medical examination, doctors will start noticing the beginning of Alzheimer's, even though that is only stage 3. Hello, so stage 4, which is called moderate cognitive decline. In this stage, you start forgetting even more. Alzheimer's is affecting your brain very severe now, and the person may be able to forget like where the person left their keys, or also the person is going to have trouble driving, or if you're engaged in a conversation, the person gets distracted and you really start noticing that.
Stage 5 is early dementia or moderate Alzheimer's disease. It is usually in this stage where the majority of the memory loss occurs. It is where the patients need day-to-day assistance in their activities, and they might even forget their personal information such as their number or addresses. In addition to that, they might forget what day of the week it is or what day today even is.
Okay, so stage 6 right here is called middle dementia, also known as moderately severe Alzheimer's disease. And during this stage, memory loss continues to worsen up even more, and the person may forget their spouse's name, and also the person cannot do things by themselves. They need help taking a bath, or they need help eating. They can't really control how they talk either.
Stage 7, which is the final stage, is late or severe dementia or failure to thrive. This is the final stage of Alzheimer's, and it is when a person communicates only with short words, mumbles, or cries. And this stage is where a person loses their ability of movement and the ability to smile or hold their head up high.
Okay, so during our research we found out that statistics say that 1 out of every 8 Americans over the age of 65 have Alzheimer's, and 1 out of 2 Americans over the age of 85 have Alzheimer's as well. Alzheimer's usually develops in elderly people over the age of 65. And if someone in your family has it, you are most likely to get it as well.
What is Alzheimer's disease? Alzheimer's disease is the most common form of dementia. It is a serious brain disorder that slowly destroys memory and thinking skills and eventually destroys simple tasks of daily living. What causes Alzheimer's disease? Scientists do not really understand what causes Alzheimer's, but it is clear that it develops from different events that occur in the brain over a long period of time. Alzheimer's could be genetic. When someone develops Alzheimer's, cells in the brain deteriorate. Some of the risks are to develop this disease are age, if you are over 65, family history, Down syndrome, and head injuries.
Okay, so thank you for tuning in with us and listening to our presentation of our Alzheimer's project.
We hope you have at least learned something from our educational video about Alzheimer's.
Well, thank you. Have a nice day.
Bye.